For many of you, eating used to be associated with fear and pain. After surgery, it's going to be difficult getting away from that. You will need to form new habits and try new things. A food diary is an important way for you to track what works for you and what doesn't. You will need to learn to make adjustments to your output through your eating habits and learn how to care for the appliance in general. Experimenting is the only way you're going to know how your system will react with food. What may not work now might work after a few months of recovery. It's best to introduce small amounts to your system and see how it reacts. Try not to let your ostomy dictate whether or not you try a food. It might be helpful to hear from Melissa. She's been living with an ostomy for 7 years. She's been in your position and she has some great tips and tricks to share. Melissa, let's start with a food diary. How important is it and how does it work?
I liked a food diary. It was super important for me because I really wanted to keep track of the foods I ate and how they affected my body as well as my stoma and how much output I would have from my stoma. So I would keep track of the foods I ate, how much I ate, and how much output it would give me, and if it was a thick output or a thin output, and if it bothered me or if it helped me.
Are there foods that will help with salt and potassium intake?
Yeah, there's a lot of foods that you can do. One are canned fruits and vegetables that have a lot of sodium in them. All of the processed canned foods have lots of sodium, so those are good to consume. Again, we talked about Powerade and sports drinks that have a lot of sodium, so we're not wanting to try to avoid that.
These things aren't easy to talk about, but let's talk about output. I assume you learned quickly what thickened or slowed down your output.
For the most part, I wanted my ostomy and my pouching system to only empty about 6 times a day. That's usually the average for most people. And I wanted my consistency to be manageable and not too watery. So I always paid attention to the foods that I ate and what would do me good in terms of keeping it at the right consistency.
And how do you keep it at the right consistency?
It depends on the foods that you eat. You can either eat foods that will thicken it or that will thin it out. And so it's really good to be mindful of those types of foods. So let's say for thickening, you would eat things like tea or applesauce or mashed potatoes, or even eating Metamucil or some kind of fiber that would help to keep it thicker. And as far as thinning, raw fruits and vegetables would thin it out for the most part.
Can you get constipated with an ostomy?
It depends on how much of the intestines has been removed, but yes, you can, or it can be thick enough and fibrous enough that it doesn't go through your stoma like it needs to. And so yes, you can get a blockage or even a partial blockage of your intestines if you're not chewing your food well and if you're eating a lot of rough foods that are hard to digest that have to go through the stoma. It's also good to know and be aware of the symptoms of a blockage of your intestines. The biggest is that you'll probably start having abdominal pain. Your stoma will probably get firm and maybe even cold, and you'll have rigidity or stiffness in your abdomen, and you'll have a lot of pain. A lot of times the output in the stoma is minimal or very thin, and having even nausea and vomiting as well can be a part of a sign that you're getting a blockage. If it's severe enough, you need to call your doctor or go to the emergency room. But there are a lot of different ways you can do yourself at home to see if you can release some of those blockages without having to go to the emergency room or see your doctor.
And what if the output is too thin? Is that a problem?
Yes, it can be a problem just because you'll get dehydrated. So you want to try to keep it the consistency of mashed potatoes to toothpaste consistency. And again, if you're emptying your pouch more than 6 or 7 times and doing it frequently, those are signs that your output is way too much and that you're going to need to slow yourself down.
What are the tools somebody can use if they feel a blockage coming on at home?
Well, it's really important to be able to relax your abdomen. So oftentimes I'll lay on my bed and put a heating pad on the back to relax my abdomen and warm up the muscles so that they can relax. The other thing is to drink hot beverages to help the intestines relax. You can take a hot bath or hot shower. And I also rub my abdomen and try to get things to relax and loosen and be able to loosen up that partial blockage.
So if you've been in your recovery process about 3 to 6 months, you haven't had any constipation or blockages, is it safe to try new foods?
It is, it is. It's sort of hard to venture on to new foods because depending on your disease process or what you had before an ostomy, and then when you do have an ostomy, sometimes we get a little rigid on our diet and don't want to venture out because we're afraid. And so it's really important to kind of let go of that and try new things and just try them in simple, small doses and see how they work. The other thing is if it feels like it gives you more output or it feels constipated, don't try to just eliminate them and be really rigid with your diet. Just introduce them again another time and see how they do. But there are a lot of different foods that you'll notice that give you more output or less output, and you can kind of cater your output in terms of what foods you want to try and enjoy yourself.
And what about bloating and gas?
Woohoo, those are always fun. We're still going to have bloating and we're still going to have gas. And unfortunately that gas is going to fill up the pouch. So there are different things to do to avoid certain foods that will cause you to bloat. And those would be eggs and even the raw fruits and vegetables, especially broccoli and cauliflower, are going to make more gas production and bloating, but also your pouch is going to fill up.
Is there an odor?
Oh yeah, there's a lot of odor if you eat certain foods like eggs, and again, broccoli and cauliflower are a really big sinful thing in terms of odor. But I don't use those to avoid eating, and most often you don't have an odor unless you open your pouch, and that's usually in the bathroom when I'm emptying it. So I'm not bothered by that odor, and I just enjoy those foods.
The fear of your new situation is normal, and it will take time to adjust. Following these few simple suggestions can make the transition smoother. Keep a diary. Learn to control output. Gas happens. Odors are nothing to fear. Food is nothing to fear. What your system can handle will improve over time. If you have any questions or concerns, please contact a healthcare professional.